I'm basically presenting about a biomarker. It's called IMP3 and it's an immunohistochemical stain. So basically what we're trying to show is whether this stain can give us prognostic indications for squamous cell carcinomas, which is the second most common cutaneous cancer in the UK anyway. There has been some work that was done previously with this biomarker, but in different types of tumors, never before in squamous cell carcinoma of the skin. So the data that's been shown is very interesting. So we thought that that it would work or translate to squamous cell carcinoma of the skin. And we didn't just look at squamous cell carcinomas, we looked at other types of lesions that may predispose to squamous cell carcinomas. These are benign lesions. So there's more than one angle really to our research, and this study is the preliminary data really. Okay, so it's a platform. What we did was we looked at a pathology database and identified all the lesions that were coded for as squamous cell carcinoma, actinic keratoses, puvakeratoses, and we basically identified these lesions. We pulled them out, we stained them with this biomarker. Some of them were not suitable for studying because either they were wrongly coded or whatever. We were left with 157 samples basically, and we, as I said, we stained them with IMP3 biomarker, and we put them into groups, seeing whether they have expressed the biomarker or not. And we saw that those that expressed the biomarker tended to be more aggressive tumors, and in tumors with patients with other conditions that predisposes to squamous cell carcinoma. And we also found that some of the non-cancer lesions, such as actinic keratoses, some of these also stained, but the majority of them that expressed the biomarker expressed it in patients who also have aggressive tumors. So that might give us an indication basically of to stratify these lesions early on. But as I said, our data is quite preliminary. This is the beginning, and we would like to do some statistical analysis and have bigger samples, etc. What could happen is that a patient would come in and we could say, well, instead of saying we don't know how this cancer is going to behave, we need to take it out and we need to review you to see how you're doing, we could say, well, we could stain it with this marker, and this marker will give us an indication whether your prognosis is going to be good or not. And that's a bit more information for the patient, but also for the clinician to know how to follow up these patients. Mm-hmm. And it may also help us in understanding how these tumors, the biological mechanism behind them, and whether this biomarker is implicated in the mechanism of the tumor, because what I forgot to tell you earlier, that it is an oncofetal biomarker, so it's only found in dividing cells in embryogenesis, and it's hardly found in adults. But we found that, well, not us, previous studies have found that it's actually expressed in malignant tissues. And its role is really in proliferation of cells and migration of cells. So it might not just be a marker to tell us how the tumors are going to behave. It may be something that will actually inform us a little bit more about the biology of how the tumor evolves.